When we talk about the Affordable Care Act, one of the things to keep in mind is that it's been a very fluid policy. Yes, it had general precepts to it, but it's been fluid in the sense of how it's been implemented, both in the Obama years, then in the Trump years, where they've tried to get it broken down by the court and not go through, where some of the main edicts have been sort of taken out and lessened or not applicable if you don't want to, such as birth control. It's also been during the Trump years underfunded and sort of not pushed out. They've tried to limit it. But what you've seen during those years is also, and there'll be an article about this too that I'll have as part of the class for this week. You'll see that also this sort of, it was a federal policy, but the states who didn't come through with the expansion of Medicaid, you have people who are pro Obamacare, going directly to the states to get the states to pass expansion, going directly to the voters. So we're sort of doing amendments or propositions. And this has been very effective in several states that were very anti it. And one of the reasons that is because people have seen the implications of people having access to healthcare. State politicians have seen, not federal, because their federal legislators might be against it, but states have seen that the states that have expansion under the Obamacare Act have been able to, it's the Affordable Care Act, but it's called Obamacare, so they're interchangeable, have been able to not have their state budgets so impounded because the feds give them more money. So they can provide health care for people who were under the expansion. And so that people who are under Medicaid healthcare plans in their state, because remember the state pays 50%, the feds pay another part, they got more money. They could expand and make people healthier. You also had the public seeing the implications of it before it was passed. And right when it was passed, everyone was saying how horrible it is, how it's going to cost a fortune. It did cost money, but once people got used to being covered by it, they didn't want to, claw it back. They wanted to keep it. And the more positive things that people talked about and the more people that were insured without limitations on what they could be insured for as far as time, with their kids being on the plans, access to health care, bankruptcies going down a bit because people weren't going bankrupt to provide healthcare for themselves and their families, then other states, other citizens in other states could see the implications of it. And that's one of the reasons you haven't been able to get it clawed back at the federal level, even through the court system, is because it is in some components and parts working and people are seeing how it works. And that's one of the sort of key components. Once citizens see how something works and once a policy is in place, it's very hard to pull it back, for better or worse. And a policy like this has been very fluid. We might see a huge change in the next administration after the Trump administration, and it might be more funded. We might try to bring back what we tried in the very beginning, but couldn't get passed, which was a public option. So that would add another third way that people could get health insurance. It would be really good for people who might see that the public option, maybe people who are younger and healthier would see the public option is a really good option. We might see more insurance companies coming back into the market because it seems like it's a better plan and they will bring back some of the lower cost policies. They might be more robust than they have been in the past. So again, it's sort of this very fluid policy, and that's something to think about as a health administrator and to watch. And it's one of the reasons why you have to be a continuous lifelong learner, because you have to see how it's being implemented and how that will affect you, and you have to see what changes might come through and how that will affect you. So some of these changes might be very small, some of them might be very big, but this is one of the reasons why a lot of healthcare is very political, because you have to see how you're funded. You have to see how each entity is impacted. You have to see how your patients are impacted. You might see, if you're a hospital administrator, that, yeah, we got more people covered, but in order to really make this cost efficient, we have to make the community healthier so that they're not coming in with so many chronic illnesses. So then you have that payment system, but you might also want to do some community-based public health or partner with your public health department or local churches, local actors within the community to make the community healthier, because then that means people will come in healthier and you won't have to have such a burden no matter who reimburses, right? So again, you have to think of the whole picture of this policy. You have to think of it as fluid through time. You have to think of it trying to coordinate and achieve a lot of different ends. And that's one of the reasons why it's sort of complicated, but also one of the reasons why it's sort of the perfect policy to look at, because A, it's the biggest one we've had in a long, long time, and B, because it has changed and it's been such a divisive policy in the beginning, but now it is sort of very much going mainstream, and you've seen a lot of states pass it, even though the feds and their governors say they don't want it, the citizens have requested it, and there's been a movement to get that passed. So it's a really interesting policy. There's a lot of ethics in it. Do you believe that human rights include the right and access to healthcare? That's sort of embedded in it. Do you think that we should get people covered and then lower the cost? Because we sort of get people covered, but the cost still goes up at a lower rate than previous. So should we now be trying to do both those things at once now that we've got more people covered? We saw during this pandemic that people who lost their jobs could then get this healthcare coverage. So that was a good thing. There was a mechanism in place for people not to lose their healthcare coverage if they applied based on their employment. And what does that mean long term? Are we thinking we want to detach it from employment? Again, that private public option maybe. So it does raise a whole lot of questions, and that's one of the reasons why it's a really interesting policy. Also because the more people have access to healthcare coverage, the better outcomes we get and the healthier society and community we get, which is not a bad thing. And you never know when the next pandemic's going to arise. So having that sort of embedded system on the ground really does help. But again, you're going to write about this and you're going to talk to me about this. So I really look forward to what you're saying and your sort of points of view.